Welcome, everybody. I'm Laura Painter, Buckeye's Senior Director of Behavioral Health. June is Post-Traumatic Stress Disorder Awareness Month, also known as PTSD. We're here today to talk with Deb Putano, who's the Adult Therapy Coordinator and a licensed professional clinical counselor with a supervisory designation at the Zeph Center in Toledo. Welcome, Deb. Most people know what PTSD means at a high level. What we often see are distressing, recurring symptoms after a frightening incident. I wonder if you could tell us a little bit more about what PTSD is and also tell us a little bit about Zeph Center.
PTSD stands for post-traumatic stress disorder. So essentially, it means that it is a prolonged stress reaction post-trauma. So after something traumatic someone experiences or witnesses, they're going to have a stress reaction that continues often for at least a month and most often longer than that. The Zeph Center is a trauma-informed agency. What that essentially means is we look through a trauma-informed lens. Instead of looking at people as what's wrong with you, we actually try to understand and look at people through what has happened to you.
Great, thank you. And what are some examples of traumas known to cause PTSD?
PTSD can happen in a whole bunch of different instances. For example, automobile accidents can create an environment for PTSD, assault, robberies, and essentially anything that would create a feeling of fear, safety, lack of safety, and also threat to human life.
Deb, what are some of the symptoms that we should look for?
Symptoms are going to include things like you'll see nightmares, flashbacks, which are different than memories. Flashbacks are actually reliving the experience. And then you're going to also see intrusive memories, things like that. Those experiences can then further trigger symptoms of panic, anxiety, and with that comes heart palpitations, sweating, dizziness, and in more extreme cases, you might see a disconnection from reality or some kind of dissociative experience.
Thanks for all that detail. I've heard that COVID-19 has created PTSD in patients and their loved ones. Can you please tell us a little bit more about that?
In the practice, what I see mostly is folks that have been isolated from their loved ones, and that's been a big, difficult thing. We're meant to be social creatures, and so it's very difficult to be isolated from loved ones, and the fear of exposure, the fear of something bad happening to you, and particularly for those who had been hospitalized with COVID, they might have been away from their loved ones and they weren't able to get that support, and they had the fear of dying, particularly alone, those kinds of things.
Deb, as clinicians, how is PTSD treated?
There's EMDR, which is a bilateral reprocessing and exposure to the trauma. We also have exposure therapy and cognitive behavioral trauma-focused therapy.
Deb, I want to thank you so much for your time here today and all the great information you provided. And I'd like to thank all of you for watching. We hope that you find this information helpful. And for more information, you can reach out to the American Psychiatric Association, the National Institute of Mental Health, and the National Center for PTSD. Thank you all for your time and joining us here today.